Welcome to Coronavirus Your Stories, a programme about how COVID-19 is changing the lives of people around the world. I'm Philippa Thomas. This week we're bringing you stories from vulnerable communities whose residents are more at risk but less in the public eye, and the efforts that are being taken to try to stop the devastation that this pandemic can cause. We'll hear what's being done to stop the spread of the virus in one of the most densely populated areas in the world, Asia's largest slum, Dharavi, Mumbai. First, a story of Native American volunteers who've banded together to help some of the tribal nations hit hardest by COVID-19 in some of the remotest areas of the United States without running water or electricity or internet access. Jo Overton in Utah started by helping to source 40 masks. Now she helps coordinate the distribution of thousands of pieces of life-saving equipment. She's working across tribal lines, monitoring the rise in COVID cases every day.
Navajo was the very first to get COVID back in April, maybe the end of March. And it happened at a large gathering, and then people went home and they were infected, and it infected hundreds of families initially. If you are Native American, you're at least 10 times more likely to get COVID, and you are at least 4 times more likely to die from it. In different areas, there are higher numbers, but that's about the average, and that's on or off the reservation.
Jo, tell us about some of the particular challenges that are faced in trying to fight COVID. I mean, I guess you're talking about some areas that don't have running water for a start.
Exactly. There are some areas, especially on the Navajo Nation, where between 30 and 40% of the people don't have running water. It also means they have no electricity and no cell phone service because they live in a really remote area, and that might be okay on a regular basis, but with COVID, it means they can't call for help. It means they cannot wash their hands for 20 seconds each time. And because Native Americans in general traditionally live in multi-generational homes, and on almost all reservation, housing is really scarce. So it means that you couldn't move to another home, even if you wanted to. So quarantining is out of the question. There's no way anybody has an extra bedroom and an extra bathroom for someone, and it puts everyone at risk in that immediate vicinity.
And Jo, you've told me before when we've been talking about the particularly high rate of infection among Native Americans.
Absolutely. And the high death rate too. There's a few underlying issues that are long-time issues, and all COVID has done is expose them. One of them is lack of good health care. Our health care on the reservations and off is run by a federal entity called Indian Health Services, also called IHS. They are funded the very least out of all federal medical programs, and that leaves IHS facilities understaffed. And it means that the doctors and nurses don't have proper PPE or anything else. And the other problem is lack of healthy food availability. Like I went to my reservation, which is Rosebud, and I went to purchase apples. They were $5 a pound. Who can afford healthy food? Not the natives. And it leaves them, all of us, with high rates of diabetes, autoimmune diseases, cancer, and all those things play into the high morbidity of COVID with Native Americans.
So you knew already that there's this situation with underlying health conditions, problems for Native American communities. And yet when it comes to something like coronavirus, this isn't somewhere where the federal American government comes in and tells people what to do and in fact gives them resources, I guess, because it's tribal governments that we're talking about and different tribal governments.
Well, Yeah, the federal government, though, according to the treaties that were signed in the 1800s, we were told, put down your guns and we will take care of you. And that included education, healthcare, food, and things like that. So honestly, the federal government is at the very bottom of the reason why the people on Rosebud, their life expectancy is 57. And so COVID is just deadly. And the federal government is not doing their job. The nurses and the doctors in the federally run IHS hospitals do not have enough gloves or protective equipment. I don't understand this. IHS got $1 billion on April 3rd for COVID supplies. We have no idea what they did with them because when we talk to them, they say, we don't have gloves, we don't have face shields.
So volunteers like you, Joe, working from your own home, have had to get involved, and uh, it might have started small with 40 masks or so, but tell me
Right.
something about the situation now. What kind of things you're helping to supply?
We have a two-pronged approach to this. One of the things we do is providing personal protective equipment, or PPE, to healthcare workers, frontline workers, and making sure that they're safe because they're taking care of the people. This is all on reservations. And the other thing that we do is a community approach where we are providing hand sanitizer, masks, sometimes food and hygiene supplies so that they can be clean and be able to kill the germs. So we're protecting the people in every way we possibly can. And it's grown from just such a small amount to, like you said, I was looking for 40 masks, and now we can get thousands to people within just days. And also like face shields and gloves, hand sanitizer. We just got a very large donation of that. We're excited to be able to share that with all the communities. It becomes life-saving when you don't have water.
And why does this matter so much to you personally?
I am a member of the Sicangu Lakota from Rosebud. I am Native American. However, I live in Utah. Most of my family lives on the reservation, but I'm here. And I just was standing there, and Navajo people were dying. I know lots of Navajo. I know all people from all the different tribes in Utah. And all I can say, I just said, I cannot stand here and do nothing. And so I did something, and it has grown, and I have an amazing team of people who are incredibly caring, and we are all working together to save lives.
So do you think you were brought up to take action?
Absolutely. And it is true of every Native American child and adult. Community before self. From my youngest childhood, I remember my mother asking me, what are you going to be when you grow up? And what will you do to help the people? I So I got a degree in social work because I thought that was one of the ways that I could really help Native Americans, and it means the world to me. My mother is a world changer, and I have a deep desire to make my mother proud, and there would be nothing more important to me than being just like my mother. She changed the lives of the people on the reservations.
How?
My mother, she was raising four girls singly, and in her early 40s, she decided she would become a lawyer. And then she would go home to the reservation and she would help the people. And even though my mother had rheumatoid arthritis and was quite crippled from it, she did. She went to law school, and then she moved back to the reservation, became not just a lawyer for the people, but a judge, at the very first attorney general we ever had, Native and woman. And she helped change the constitution of our tribe, and she also rewrote the domestic violence code for two different tribes, including ours. my mother was always a voice for the voiceless and protection for the vulnerable.
And a lot of what you're doing now is about protecting Native elders. I suppose there's a double risk here, isn't there? Being Native American, and if you're elderly, you must feel very vulnerable.
Absolutely. Native Americans treasure their elders. They are the holders of the past. They know, they carry the wisdom and they carry the knowledge, and they teach us. But one of the most important things is that they are also our future. Without them, we would not know which way we needed to go, and we would be lost. And in that process, we would lose a part of ourselves. So protecting our elders is the most important thing that all Native Americans feel that we can do.
Just thinking about your part in this volunteer effort, what do you think you're learning, or the group of you are learning, that might help you if there's another wave, another surge of the virus?
Well, we're really aware of the things that work and also some of the things that don't work. And we're hoping, if there is another, well, right now, COVID is just beginning to rise on the reservations across the country. And it means that we're pretty prepared for their needs. And so it makes it easier to know what they need. We have a warehouse, we have things in the warehouse, and we can get them out quickly. So if COVID is rising in a place, we have a rapid, focused response. And that is our mission, to do that.
What will you take a lesson from and say, right, do it differently next time?
Well, I think one of the most important things that we've learned is about having good contacts. So when I call as the Indigenous Outreach Coordinator, I really need to find somebody who is willing to talk and respond to emails and be able to get the supplies out.
And in making things happen and making them happen quickly, how much do you think it matters that people trust you because they think, well, you know what you're speaking about, you are Native American?
Absolutely. Because I understand the difficulties that the different entities on the tribe are having. And so when I speak to them, there's already this common ground. And in doing so, it engenders trust and a willingness to tell me things that they perhaps would not tell a white person because they would not feel like they could trust them.
You obviously are determined that you and others are going to be communities helping their own communities, because there's no other way.
Absolutely. We are moving very, very quickly, and we have great hope. Protect Native Elders. All of the money that is donated, besides a very small portion, goes straight to supplies. We are 100% volunteer. We don't stand around and say, oh, let's wait for them to do it. That's ridiculous. We do it.
Jo Overton on the challenges and community spirit that she's witnessing among Native American people trying to deal with COVID-19. Next, it's 1 square mile but home to nearly 1 million people. Coronavirus in the largest slum in Asia.
Get your daily roundup on the coronavirus outbreak from the Coronavirus Global Update podcast, with reports from affected areas, details of the latest medical information, plus the impact on health, business and travel. Available from bbc.com or your podcast provider.
On Front Row, I'm looking at the future of performance culture in the wake of COVID-19. Can we expect theatres to reopen their doors anytime soon? And will the current crisis actually create opportunities? Join me, Mary Beard, on BBC World News.
The death of George Floyd here in Minneapolis sparked calls for police reform in America and protests around the globe. As his killing continues to reverberate, we ask, what will change in America really look like? Join us for the latest developments on BBC World News.
Welcome back. I'm Philippa Thomas and you're watching Coronavirus, Your Stories, a programme about how lives around the world are being changed by COVID-19. This week we're talking to some of the people trying to protect the more vulnerable communities. Like Dharavi in the Indian city of Mumbai, a slum that's home to around 1 million people living in just 1 square mile. With poor sanitation, overrun healthcare services and social distancing all but impossible, containing the spread has been a monumental task. But the efforts, for now, seem to be working. Kiran Digovkar has been overseeing the official response.
So in just 2.5 square kilometer area, you'll find 1 million people in Dharavi. And they are all staying in small houses of 10 feet by 15 feet. Small houses, and usually you'll find structures of ground plus 1 story or 2 story, in which people are staying in ground story, people are staying, and on first and second floor there are factories, small factories, where these people are working.
So how is it possible to socially distance, let alone isolate, when you've got a virus among you?
80% of people depends on community toilets, public toilets. They don't have their own individual toilets. Second important part in Dharavi is all workers, standard laborers, migrants, they depend on outside food in Dharavi. They don't cook food inside. Means maybe 30 to 40% people don't have kitchen inside their houses. They just depends on outside food. Once the lockdown was declared, most of them were unemployed. And they were waiting for food, means daily food, and we were providing them food packets every day. Means 21,000 people for lunch and 21,000 people for dinner, we are providing food packets to them. So there is no possibility of practicing social distance. So for us, the main challenge was that only, that to isolate as much as people possible. And to isolate them into a government quarantine.
And how well has the strategy worked? Because when you look at India as a whole, it's got the 3rd highest number of cases after the United States and Brazil. But in Dharavi, how's it going?
Yes, Dharavi, surprisingly, as I told you, first case was on 1st April, and that was a death case. The person was detected positive, and when we went at his home, by the time we inquire his family about contact tracing, high-risk contacts and all, the patient who died in the hospital. And we completely were aware that the way the community is, it will take no time to spread, and it happened like that only. Instead of just acting reactively, we decided to act proactively. So what we did is we started screening people in the area. We took a team of doctors and we started visiting door to door with our PPE kits on. And we started with the help of thermal scanner. We started screening people. With the help of oximeter, we started taking oxygen level of the patient. And those who were suspected, we just isolated them and appealed them to isolate. We started announcing people that those having symptoms of corona, just isolate yourself into our quarantine center. Will provide you everything free of cost. So this strategy has really worked, and we have isolated more than 8,500 people till date.
Kiran, were people happy to do that? Because if you go into isolation, you can't work, you can't earn a living.
Most of the people are working into essential services. Means most of them were health workers, grocery shop, delivery boys, maybe working on a petrol pump. Maybe there are few people who were in essential services as well. Initially, if hiccups were there, they were not ready to come. But once we offered them medicines as well, means HCQ was the big booster in the area, because once the person was isolated, we used to give him, or right now also we are giving them 3-course food, like breakfast, lunch and dinner. Along with that, we are giving them multivitamin tablets, zinc tablets, HCQ, then any other symptomatic treatments which is required. Doctors were appointed, nurses are there, ward boys are there. So this much of facility with no cost. So that was a pretty good deal for them.
And what about yourself? You're coming into contact with a lot of people who might be infected with COVID-19. Aren't you worried about yourself and your family?
Yes, initially it was quite a tense atmosphere when we used to go. I used to wear no doubt a mask, then face shield, then I never wear a PP kit, but I had a gloves in my hand, mask, goggles, means not exactly goggles, but specs and face shield. Because while setting up of these quarantine centers, we need to visit frequently to check how it should be, how the bed should be placed, and we were worrying. So there were initially quite a scary situation, and everywhere it was on news that Dharavi cases are rising in Dharavi, and it was become a cause of concern for my family as well. And
Kiran, I want to ask you a final question about having so much responsibility. There must be quite a lot of personal stress involved for you.
one of my staff died, means who found positive while distributing the food packets in the area, and he died. And that was a shocking and very bad day for my entire staff and myself, including myself. And that was a really scary situation. And that day, we tested 30 people, in 30 engineers and doctors in the area, and 21 of them were positive. And that was really a scary situation. And interestingly, I'll tell you, though I have not shown any symptoms till last 2-3 months, but I never tested myself because I was aware that once I test myself and we found positive, what will happen to this mission Dharavi? So I have decided that unless I show any symptoms, I'll not test myself. So that was really disappointing when one of my staff was died because of COVID-19 only. And that was really stressful during that time. April was very bad when there were 100 cases a day. Then that was during April last week. Then somewhere we started feeling top of the situation when the infrastructure facilities were built up, oxygen beds were built up, hospitals were acquired. Then there was little sign of hope developed, and now it is completely okay. And I'm happy that the entire other areas of Mumbai are showing the increasing trend, and Dharavi is now quite under control and showing the decreasing trend.
Kiran Digovkar on the pushback against COVID-19 in one of the most densely packed patches of the world. I'm Philippa Thomas. Thank you for joining me this week for Coronavirus, Your Stories.